Hi everyone, today we're joined by Kristin Dascomb, Intermountain's Medical Director for Infection Prevention, who is going to be talking to us a little bit about the different types of masks that are out there currently, and also when you should be wearing them, who should be wearing them, and the importance of the masks. Kristin, thank you so much for joining us.
Thank you for having me.
Really appreciate it. This topic is very on the tops of everyone's minds right now. On Friday, we moved to a moderate risk phase with the state. And one of those suggestions was to start wearing a mask in public. And also a lot of stores are now recommending or requiring that you wear a mask. Do you want to talk to us a little bit about the different types of masks? There's pleated masks, a cloth mask, you can wear a bandana. There's also medical grade masks. Kind of give us an overview of what's available.
Absolutely. So protection sort of started with the surgical mask, which is what we all are used to seeing in healthcare, right? They are initially designed, actually, to protect not the wearer, but the person a surgeon is working on, the wound, or to prevent my secretions from going into a surgical wound. They weren't initially designed for our protection. That being said, we've learned over many years that when we as caregivers wear them, we are protected from many of the respiratory viruses, such as influenza and other things. And so we have learned that there are certain aspects of the design that are important to help protect our mucous membranes, which is where we acquire these viruses, from acquiring them specifically. One is to have this nose piece, it's bent, you can see. This pinches over the nose and helps sort of secure the nasal area from getting infected. It also tucks underneath the chin to some degree, and that helps protect the mouth and from also inhaling those particles. Now, we don't all have access to these, and if we did, we'd probably, unfortunately, use them all up for our purposes in the community and not for our healthcare workers who are exposed so frequently. And so there are other options. One is we are creating our cloth masks. This is also used for our own respiratory protection at this point, and we're using them to cover, again, our nose and our mouth to help protect against the same acquisition. Ideal for these is to have it cinch as much as possible over the nose and underneath the chin. And sometimes we want to make sure that fabric is big enough so that our facial contours are covered and that we can ultimately cinch this. This one happens to match my outfit. It also happens to have this interesting strap that comes back behind, and you need to pull these, which are actually very nice, and would probably survive many washes. That being said, it might be a little more complicated for people to be able to put on, and something to consider when you're trying to create a mask. The third option is something in between. This is Project Protect's mask. These are made of a surgical grade material and made by, again, our wonderful community in Utah. The surgical grade material has one aspect that is comparable to the surgical mask, and that is it has a droplet barrier. It has a wetness barrier that prevents those droplets from someone else coughing on you coming in, and that's one step above a cloth mask. And so when you wear a cloth mask in the community, which is what we recommend, we also recommend that you maintain social distancing. This helps us to prevent those particles from getting all the way across because we don't have the wet barrier that the surgical masks or the Project Protect masks can support us with. And so, yes, it is recommended to utilize as much protection as you can, but of course, when we do utilize it, to utilize it properly, and that is with social distancing. To put it on properly, since we'd asked that before, we highly recommend that you wash your hands, whether it's with hand sanitizer or other products. Just washing hands in the sink is perfectly fine prior to putting the mask on your face. Mm-hmm. Why is that? Your hands are going right in those mucous membranes that we just talked about that could potentially cause an infection. And so washing your hands prior is important, and then once you've touched your face, washing your hands after if you're going to touch other people or other things.
So a couple of questions for you, specifically around the different fabric types. If you were making a cloth mask yourself at home, Is there a certain fabric that you should be making them with? Does one work better than others? What are your recommendations for that?
So 2 things. One is the level of protection, and the other is comfort, to be able to breathe, right? If it's too dense, you won't be able to breathe, and it's very uncomfortable. If it's not appropriately thick enough, then it's not going to incur any protection. And so we usually recommend cotton, 100% cotton if possible, and at least 2-ply, so that we can ensure that there is some level of protection. The masks that are made by our community here in Utah all have those specifications, and those are the recommended from CDC.
What about a filter? A lot of people have asked if they should put some sort of coffee filter or a paper towel on the mask. Does that make a difference for the person wearing it or the person that they're potentially interacting with?
I don't know that we have any evidence specifically on those particular products. While caregiver masks have various things like specific types of filter material that help protect the caregiver when they are wearing them, there hasn't been any data to demonstrate that those additions actually help protect the wearer anymore. And sometimes, as I mentioned, when you make the mask more thick, it can make breathing more difficult. So we don't recommend that at this time.
I know, too, with the breathing aspect, I've worn the surgical mask, and you have to make sure you're wearing the correct side. I actually wore it the incorrect way and noticed myself it was extremely hard to breathe when it's incorrectly worn. So being aware of which side's supposed to be facing out and which side you should be breathing into, I think, is really important. Another thing is what happens after you wear it. So you go to the grocery store, you put it on before you get there, I'm assuming. When should you take it off? And then what should you do with the used cloth mask?
So for cloth masks or other types of masks, if you're in the community, I would recommend that prior to exiting your car, when you're in your car with your family and there are people that you live with in your nuclear family, you've all shared your germs and that's where you live. But once you exit that vehicle, then you have the potential to either spread your germs, which, as I said, the idea of the mask was to contain your germs so you weren't spreading them to others. And so once you are leaving that car, the ideal is that you would put that on at that time. And the reason is because you don't want to have that accidental introduction to someone else where you could spread your germs and potentially infect someone else if you didn't know you were sick. So we recommend wearing it the entire time, always, as I said, covering the nose and the chin underneath. So all those mucous membranes are covered. Many times we see folks who are trying to be nice, wanting to chat, and pulling it down below their nose so you can see them smile, or just opening it up just a little bit to say hi to someone. And those are the moments where you have the potential for more exposure, both for yourself and then your germs to others.
And should you be washing them after you use them? Can you spray them with Lysol? What's the best after use care for them?
Absolutely. As I mentioned, once you've worn it for a long period of time and you're going, let's say, back into your car afterwards, ideal is to wash your hands, because now you've touched, let's say, your groceries in the cart. You've touched the cart, which everyone else has. You've touched your car, which has been out in the weather. You want to wash your hands before touching your face. You pull off your mask, and you can put it into anything like a paper bag or something to get it home safely. Once it's home safely, immediately wash it, ideally. That way the germs that you've coughed into it or that you've spoken into it are released, as well as anything that may have splashed, such as droplets, onto that mask as well.
For the surgical masks, too, if someone does happen to have them, are those single use or can you reuse them a few times?
Ideally, yes. And remembering when I said that we wanted to wash our hands before we touch our face, the idea of the protection, especially that water barrier we talked about, is that they can collect pieces, little droplets of on someone else's cough or even yours into the mask. And so if you don't, there's no real way to wash those. And so because of that, there's always the potential the next time that you grab it that your hands are again contaminated or you're putting up that dirty mask up to your face. And so we don't recommend surgical masks be reused at this time.
So what about for children? I know there's a lot of people out there that are having trouble getting their kids to wear a mask if they have to take them in public. What are the recommendations as far as ages go? And then how do you encourage children to wear a mask and explain to them that it's very important to do so right now?
Definitely under 2, probably almost impossible. They don't understand, and they're small, and we don't really have patterns for sizing at that age group. If you can explaining why it's important, explaining that it's fun. Sometimes just playing dress up to kids is a lot of fun and can make it interesting. I know when my girl goes to the doctor, the first thing she wants to do is put on the mask because it can just be fun to her to be a little different and feel a little unusual. So if you can encourage that behavior, sometimes it can make it fun. Buying them or making them with fabric that they like. Things that match their clothes or colors that they enjoy can sometimes help as well. Or even having them help make it. There are many kids in the 9 to 10 age group that are really interested in learning things like sewing. It can really be a nice activity and make them more excited about being able to wear them as they go out.
Good advice. I like the matching to your outfit aspect of it. It can be fun, especially as the state starts to open up a little bit more. There's a potential for more events with people. So having that fun little play is probably good for children. Another question along that lines too, I feel like a lot of people are struggling with this concept of actually even wearing one. Before they even get one, it's a why do I have to? Am I being told to because I'm being told to? Or is it something that's proven to really make a difference? What are your thoughts on that?
It's a tough one because I think it is uncomfortable for all of us. We've all been told that, our face is sort of the center of our world and how we express ourselves to the world. And it can make us feel uncomfortable to breathe. It can make us feel uncomfortable to exist in the spaces with other folks. And so, yes, it can be very different and very challenging for a lot of us, both socially and physically. That being said, it has definitely been shown to reduce the risk of transmission of my cough as a wearer to others, and possibly it may decrease the risk of your cough to me, which is equally as important to both of us. And so as we make our forays now into the community, it's important that we understand that while younger folks, for example, may not be at as much risk for hospitalization from this illness, those that they see at the grocery store who are over 60, who have lung disease, who have chronic medical conditions, may be very much at risk for hospitalization, ICU stays, or very complicated hospitalization stays, or maybe even death. And so if, as a young person, for example, they didn't even know they were infected, they may not even have symptoms. But just by wearing that mask, they may contain their own secretions and not pass it on to the next person, which then saves them a lot of heartache, their family a lot of heartache, and our community a lot of heartache when we hear about continued transmission and further deaths in our community. So yes, it's absolutely important from not only containing your own secretions and passing on to others, but potentially protecting yourself.
The asymptomatic part, I think, is really important, too, for people to understand that I, for once, am not sick. I usually get sick very frequently, but I am not sick, but I know that I should wear one in public because there's still a chance that I'm carrying the virus around, and Absolutely. I just don't know. I've also talked to a lot of family members about the signs, or about the fact that it's a sign of respect. So when you go to the grocery store, that person ringing up your food has to work. They're working, and they're required to wear a mask to keep not only you safe, but themselves safe. So showing that same level of respect is really important. It might feel weird, like you said, but I think once you start to get back into this idea of going out in public and wearing them, you'll get more used to the fact that you have to.
I agree completely. I think it's a sign of respect, as you say, to those who are required to work at this time, whether it's a healthcare worker, a food service worker, those who work in grocery stores, doing all the stocking for all of our supplies that we have to buy. These are all people who have to be out and have to be in our community, and many of them have to work whether they have medical conditions or not. And so it's very important that we pay them that respect. I completely agree.
And there's also those people that are more high risk who have to go to the grocery store or to pick up their medication that they don't have anyone else taking care of them right now. So I think it's also important. Sometimes I feel like you can hear people say, well, why are they out in public? And they might not have a choice to be out there. So again, it's just a sign of respect and being aware of your surroundings. We just got a comment too that people that at the very beginning, people were told that they didn't help, and now they're being told that they should help them. Did the data kind of come into play for that, or what was the change, at least from a state's perspective, as much as you can answer on that, of why we should start wearing them now?
Certainly. At the beginning of the epidemic, we didn't have things like cloth masks, for example. And so all of the masks that were out there were those for healthcare workers. And we knew at the beginning of the epidemic, as we were entering this, that we would have scarce resources. We knew that we were already having trouble acquiring many of our normal products that we use just to care for patients on a day-to-day basis. And so if we encouraged the public to purchase masks that we almost couldn't acquire already, we may not have those supplies to be able to care for their parents, for their children, for others. And so we wanted to make sure we could acquire those supplies as best we could. We started to learn that these types of masks really did support our caregiving. We weren't seeing our caregivers getting sick when they were wearing these masks. So when we recognized that, we started deciding, okay, if it works in our caregivers, let's see for those asymptomatic patients. Those seem to be the ones that are really transmitting disease without us even knowing it. Mm-hmm. Maybe we can interrupt that transmission as well if we just all wear our masks when we're in public and wash our hands pretty well. That helps too. And we are noticing that that is the case. And so while we don't want you to purchase the medical grade masks, we are still in a fairly good crisis with our supplies across the country, across the world. That being said, being able to utilize products like this can interrupt our transmission from those asymptomatic folks out in the community and can really help reduce our risk for all of us as we go about our business and open up our communities again.
I also think people should remember that this is a novel coronavirus, meaning it's new. It's only been around for a few months. So the more that science people learn and the more that we're able to provide data to people, the more we can educate the public. What we knew 4 months ago has definitely changed now. What was happening a week ago has changed now. And I think that's really important for people to remember. Someone else just asked too, if we wear a surgical mask and then wait a few days, if they do happen to have one, can the mask be reworn? And I'm not sure what specific surgical masks they're asking about, but in general.
There is a certain amount of time after which the virus specifically will desiccate, meaning it will dry out because it has to live in some level of fluid in order to survive. So if it's left, for example, if your mask dries for 14 days in a garage all alone and no one touches it, there is that possibility. Is it 100%? I can't say that. Mm-hmm. We don't necessarily recommend that. We'd prefer you to have something washable that we could actually know that when you wash it in high heat, that we have killed the virus and removed it specifically from that fabric so that when you pick it up the next time, you're not contaminating your face with your hands or your face with a mask.
Also, if you don't have access to a mask, if you don't have a sewing machine or anything like that, what are some resources that people can rely on to get a mask right now?
So the state of Utah is actually supporting everyone getting their own mask. So if you go to utah.gov, there is a place where you can enter your name and you can be supplied with a fabric mask, much like these. You can also go to Project Protect. We are looking for more folks to help us make these to really support our caregivers and our patients. And so Project Protect does have not only kits to be able to help make some of these for our caregivers, but also how to make your own CDC patterned fabric mask as well. So those can be resources that could be very helpful to really support yourself and your community.
And the medical grade masks that you're talking about for Project Protect, we're looking for volunteers every week. There's a pickup every Tuesday that happens. So our pickup for today's are over, but if you want to get involved, you can get involved, like you said, on projectprotect.health. There is a clinical guidelines and instructions, and then there's those cloth instructions, which is really great to get involved and to give yourself a little bit more of something to do during this time if you're needing it. Kristin, anything else you want to mention today about masks wearing or anything in general?
No, I think we're very grateful to our communities for really reaching out and supporting us both with creations of these amazing fabric masks for our community wearers, as well as the Project Protect masks to help support our caregivers throughout our community. These are generous and wonderful contributions that really help protect us and really bar the transmission of a very insidious little virus that we've found. We're really grateful for all of your participation, and we hope to continue to serve you in the community in the future.
Well, Kristin, thank you so much for joining us. We really appreciate it. And again, that website for you guys for Project Protect is projectprotect.health. There's a volunteer and get kit button in the upper right-hand corner. And then there's also those 2 different guides for clinical masks and for the cloth face coverings. You can also go to coronavirus.utah.gov/mask, which is where you can get the mask if you do not have one. I know that they're asking for if you do not have the ability to get one, you can qualify for one throughout the state. We also have our COVID-19 hotline number you can call if you have symptoms at all or have questions about the virus itself. That's 844-442-5224. Thanks, everyone. We'll talk to you next time.